and I'm sure I'm not covering everything, and what I can only offer is what I know, and I can elaborate a little bit of what I know a little bit more, and the rest is just what I understand, and the rest is to the floor. Really, I'd love for any feedback from you guys. So let's go and jump into there. Let's talk about acupuncture first. So acupuncture, what we know is that it does stimulate the release of pain-relieving substance from the brain, spinal cord, providing more generalized analgesia. Okay, the treatments may last for sort of 10 seconds to sort of 20 minutes, with an average of 4 to 6 treatments being required. So these are performed once or twice weekly. It depends on case to case. Okay, the frequency of treatment really depends on each individual treatment, each individual animal. Just like all medication, complementary or not, you are tailoring the medication to that individual. Okay, acupuncture is one of the safest therapies, so complications rarely, if ever, develop. So a few different things which I'll say about acupuncture is that, coming from a Chinese background, in Singapore we do have the advantage of 2 doctors, the Chinese doctor or the Western doctor. So we know where to go depending on what problem it is. Example, if I play basketball, I sprain my ankle, I'm not going to go to the Western doctor, because it's just going to get me to take paracetamol, ibuprofen, and rest. Whereas I go to a Chinese doctor, you know, they do acupuncture, they'll do sort of a bit of pushing my joint back, and making the blood flow over there again to improve the inflammation and things like that. So so I grew up with acupuncture. So I sort of understand a little bit more behind it, and my uncle is also a Chinese doctor, so you know I sort of grew up with that really. So I love acupuncture, and but what we know is that, coming from a scientific point of view, okay, it's not just sticking random needles in random places and hope for the best. There's actually a very good sort of a biochemical basis behind it, because they've actually measured that before acupuncture, after acupuncture, the level of endorphins, enkephalins, your serotonin, it all changes, it all increases to actually improve the sort of release of pain relieving substance from the brain, from the spinal cord, to your whole body rather than just that location itself. And so that certainly is there. Okay, so treatment wise, it just depends from animal to animal. We tend to say that acupuncture, it sort of breaks down into just like a drug. The way I view acupuncture, the way I tell owners is, it's just like a drug. 80% of them, you have good predictable response, whereby they get better until to a certain extent. 10% of them are what we call non-responders. They just don't respond to it, just like how somebody takes aspirin, just don't take the pain away. 10% of them are what we call hypersensitivity customers or patients, whereby they cannot stand the prick of the needle. They get so stressed and so tense, it's actually making it worse. They just don't want to be there. So those is what we say that, okay, probably not the best treatment for this particular individual, so to speak. So that's what we sort of understand really. And usually it depends on how long the treatments are, also on the individual. Okay, so like I said, anything from 10 seconds to 20 minutes. So it really depends. Sometimes when you if you go for acupuncture, so in NHS, they also have acupuncture as part of their normal protocol, which is, you know, to be really honest, quite a big deal really. They actually make it as part of the protocol for knee. So you got stifle injuries, you can actually go there for acupuncture treatment, so they've got a protocol for it. And they always ask you, are you going to drive after this? Because it can actually cause sedation, because of the release of sort of pain-relieving substances from the brain. It can make you feel, that's quite nice and relaxed, and after that you just maybe fall asleep. So they ask you whether you're going to drive. So similar for animals, in my experience, what we find is that after you do that, once you put the needles in there, they may just not fall asleep, but they just get sedated and just chill out over there, so to speak. And sometimes this effect can last for the next few days, which is why we always tell the owners that over the next few days your dog may look worse, but if that happens, it's a higher chance that acupuncture is going to be good compared to no difference whatsoever. It could be more likely to be a non-responder. Does it make sense? So the reason I mentioned that is because of the duration, 10 seconds to 20 minutes. Sometimes 10 seconds is all it needs for a patient or a person that responds to acupuncture very, very well. You don't have to leave the needle in there for too long. You actually stimulate the acupuncture point, pull it out, that's it. Any longer, it may become even more sleepy, and it doesn't enhance the good effects, it just exacerbates the side effects. Does it make sense? Not that being sleepy is too much of a side effect. Okay. Then after this, usually we talk about average 4 to 6 treatments. So usually what we call a starter pack. So I'll be doing one treatment for once a week for 4 weeks. Then after that, come back in 4 weeks time or 6 weeks time, and depending how often you top up for. like I said, because it doesn't involve any drug, so it is certainly one of the sort of safest therapies around. And if you're interested, next month our sort of evening presentation is all about acupuncture. So that is where I'll delve into a little bit more about the evidence behind it, case studies and things like that, a little bit more about that. But yeah, so that's just my rough talk about acupuncture right now.
Acupuncture was the only way that we could reach a diagnosis for myalgia. Because you can't get a pain response on palpation, needles don't lie. So the only way that we can narrow down exactly where his pain was and then go through the right routes to be able to get to a diagnosis was because of the acupuncture he has. And now that's all he has with pain relief once a month.
Good. And I have to say that, I mean, I don't know how many of you know vets who do acupuncture. You may find that for those that do acupuncture, you may find the way they examine an animal is slightly different as well. Because usually as vets, conventionally we are taught, check the gums, listen to the heart, look in the eyes, look in the ears, and palpate the tummy and things like that. But with acupuncture, we actually learn how to palpate the muscles and feel each of them, specifically looking for trigger points and things like that. So personally, that's one big thing which I got out from this acupuncture. Whether I do acupuncture or not on the animal, it has changed the way I've examined the animal, just because I'm feeling the definition of the muscles, the sort of little bands of muscles and things like that a little bit more, but that's just personal. Hydrotherapy. Okay, so hydrotherapy broadly divided into two different groups. Okay, so water treadmill or hydrotherapy. So certainly there are experts in this room that is much more knowledgeable about this than myself. I'm just going to give you my 2p worth. Okay, so from what I understand, water treadmill, as you can see over there, is quite a cool contraption. And may I also remind everybody that this contraption is not cheap. So
I can guarantee you that.
Yes. It's not cheap, okay, and I've looked into the price of those before because I've got a very good friend who set up a sort of hydrotherapy. I was like, what? How much are you charging? It's like, oh, how many dogs do you have to walk through a treadmill to actually break even? A lot of dogs, okay. So, but it's a very, very cool. Having said that, the mechanics behind it is very, very cool, and that's me, the geek showing out. Because the dog, can you imagine, walks in from here, the gate opens without the water inside there. Walks in, then when the gate shuts, then the water slowly fills up all the way up to whatever sort of a height that they want to go to, depending on what wants to be exercised and how much support they want the water to be supporting the animal for in terms of exercise. Then after that, they start the water treadmill. But that's waterproof. Have you guys ever like spilled drinks on your on your treadmill and go, oh, it's all electronic sort of thing? But yeah, so that is waterproof, which is pretty cool as well. And after that, after a certain time, then they stop. Then they drain the water out. They all have their own different regimes to find out exactly what are they in there for. Is it a post-op? Is it wanting to make the animal or allow the animal to use the leg more without putting too much pressure on the body, on the weight on the leg itself? What is it just for fitness? Is it just for some older dogs that's arthritic that just wants to come and have a good constant exercise of your legs, of his legs and things like that? Then after that they drain it. Then not only do they drain it, don't forget, the water is now sort of a little bit tainted with animal fur, so they got filtered away before the next animal comes in. So a lot goes into that really, the whole thing behind that, how this actually works as a practice. It's pretty fascinating. So people don't really see that. They just come in, on treadmill, there's a bit of water, then I'll just finish it. Oh, that was easy. It's like going to a swimming pool. It's not really. It's pretty cool, I feel. But yeah, so there's water treadmill, okay. And one advantage of that is that you can actually regulate what are the legs doing. If you want it to walk slow, you put on a slow speed. Go faster, it goes faster. And you can actually be quite in quite close proximity to the animal to sort of gauge how's the animal doing, looking up to you, trying to entice. Sometimes you get owners standing in the front, say, come towards me. So there's a lot of different various ways of how it can be worked. But fundamentally, what we're wanting to do with this is that you're wanting to use the water to support the weight off a little bit. So it depends. As you can imagine, if you have the water just filled up to your sort of ankles or the sort of carpus or just to the stifles, you're just supporting that bit of weight. Okay, so it's not as much as coming all the way up. So it's just different variants, and also pushing through the water. How much water are you wanting to push through? It's almost like the animal's version of aquafit that we do in the swimming pools. Okay, so that is a sort of water treadmill, whereby you have a controlled motion of your leg just going in one direction. Okay. Then your hydrotherapy, okay, whereby you get a float, jump in the pool with it, and usually that I know of, the hydrotherapist will be in the pool with them. Okay, so it's very different from just chucking your dog in the river and saying that's hydrotherapy. It's not. It's a whole different thing. Okay, so you're in a pool with them, so you're wanting to gauge, and certainly this one allows much freer movement, because now you're not walking on something, you're also moving on something. You're not walking in a straight line. You have all sorts of directions that you can go to depending on what you want to do. Okay, and this one is also, like I said, the biggest thing about this, and please correct me if I'm wrong, is that it has to be controlled, because in some conditions, flailing your leg all over the shop is not hydrotherapy. It's actually it's worse for the joint. So it has to be controlled. Okay, and that's why, in my experience, from what I understand, is that the hydrotherapist is in the pool with it, guiding the dog where he wants to go. Okay, supporting the animal and looking at where the legs are moving in response to what is in the pool for. Is it post-surgery? Is it for exercise? Is it for fitness? And things like that. Very different from, my dog has got hydrotherapy because I bring it to decoy, like every weekend. It's nothing like this at all. Okay, and same again. So that it's a sort of art on its own, really. Okay, and so
the biggest difference though between one of the biggest differences is the temperature of the water. For it to be therapeutic, it's got to be between 28 and 32 degrees.
There you go.
And if you get that in the local water around here,
you'll be in the Mediterranean. Exactly. So certainly temperature makes a difference as well. Yeah. All right. So that is one of the complementary therapies. So physiotherapy. Okay. So it's defined as it helps to restore movement and function when when a patient is affected by injury, illness, or disability. So it is, as you can see, it doesn't involve water. Okay. But physiotherapy is whereby there is a certain set of movement to encourage the animal to use that joint or that muscle in a certain way, to encourage the right movement of that when it's actually not supported. Does it make sense? Okay, so if let's say you have strained your muscle in the back, then you want to exercise the muscles your physiotherapist will tell you to exercise your muscle in a certain way to strengthen that muscle again, to enable that movement to come back again. So with that, it itself is also an art, okay, whereby they do sort of various movement along the plane of you can see this lady over here, with the back leg over there, probably just trying to exercise it in that plane rather than just trying to go all over the shop. Okay, the exercise in the plane, so it actually develops the muscles in the right area in the right way, so to speak. And you can see it gets more advancement. They use different equipment to sort of gauge how stable is this dog. Is this dog able to stand on the balance and balance itself? Or it's just, and some of them they have gone through. I mean, this dog looks relatively fit to me, really. But some dogs after a spinal surgery or something like that, they need help to encourage movement in that particular location again, and how they move, how they stand, how they sit, how they sort of take 2 steps forward, 1 step back, and how they sort of the texture of it when they feel something. How do they take a step up to the next step? And we have seen like videos of people who have sort of physiotherapy after having a spinal injury and learning how to walk again with help of other people. So similar sort of thing. Okay, except this for animals. So that's also a very, very big sort of a group of a art form, okay, a treatment form that we use together to manage arthritis. Oops. So laser therapy, okay, so this is a sort of a cold laser, sort of a non-invasive procedure that users like to stimulate cell regeneration and increase blood circulation. Cold laser therapy treats the surface, while the hot laser treats the inside. Class 3 and class 4, so same are sort of commonly used. So same again, this laser therapy has been sort of around for quite some time, but it has sort of certainly gained popularity in the last sort of 7 or 8 years, with more and more companies coming out. Used to be 1, and now there are like 4 different sort of companies coming out with their forms of laser, okay, and there is a lot of different things that you can say about that. The advantage of that is that as you can see, it doesn't really involve a drug. It involves putting a laser onto the joint that's affected, okay, while they use sort of a cold laser for the surface, hot laser for the inside, class 3 and class 4. So from what I understand, class 3 is the less powerful laser, and that's usually used by sort of physiotherapists, and that's been around for quite some time already. Whereas class 4 is a more powerful laser, and from what I understand as well, I think you may need a...
Costs about £25,000.
Oh yeah. It costs a lot of money. So class 4, you get anything between £12,000 to £25,000 for the kit. Exactly. So if somebody is charging you £60, then just think about how many treatments you have to go through to actually just break even. So
you also got to consider how deep they
yeah.
go.
Yeah.
Considering we're talking millimetres, if the dog is slightly overweight, you can have it lasered as much as you like. It's not going to do anything to the joint. And I think that it looks good. I think people feel it looks good and they feel so doing so. But if the science doesn't back it up unless you've got a slim dog and a very superficial joint.
I would say to that is every treatment is tailored to the individual. So I understand exactly where you're coming from. I would say in argument to treat arthritis, in that case, lose the weight first. That's probably more effective than using laser, so to speak.
But a lot
So
of places,
yeah.
like you said, now there's lots of companies, lots of places now going, you can have laser because that's the one thing they can offer. They haven't got to go and buy
It's not a
hydrotherapy.
Yeah.
It can be done at the vets, it can be done by the vet nurses, it can be done at the physio, and it makes an owner feel that their dog is having a treatment.
Yeah.
Actually, the science for lasering, unless you've got it for the right dog, it's brilliant. But it's so you've got your £25,000 outlay for a class 4, but then you're actually limited to which dogs it's going to help.
Do you see how terrible business people we are? And yes, we still buy it. So there we go. No, I totally understand exactly what you mean, but you can also see where we come from, so to speak. So certainly, I'll probably say the same for any treatment. Really, not all treatments is good for everything. So certainly everything is pick and choose, and this is what's available out there. So from what I understand, class 4 is more powerful than class 3, and correct me if I'm wrong, class 3 is usually used by physiotherapists, class 4 they're used by vet nurses for whatever reason, and I'm not sure whether...
Physiotherapists can use class 4.
Okay.
It's
I'm
just
not sure
literally
if there's anybody in this by itself that's got a class 4. I'm not sure.
I know the...
What, in, around here? Yeah. I think Powderum has one, and so there are some. So anyway, this is one of them, and certainly there's a cool factor because you get to wear the doggos, and because it's obviously the laser itself, it can be you have to be quite careful that you don't point to the eye. Not that anybody would, but for sort of for safety, they give it for the dog, they give it for the humans, and things like that. But it is out there as well. So how well it works, verdict is out there. Certainly there's a lot of evidence, which there always is before they sell something for 25k. And but obviously the dogs, they tell you. Yeah. So other complementary treatments. Okay, this is where I am going to admit first that I know of them. I sort of heard of them and understand a little bit, but I certainly do not know too much in depth. Okay. Homeopathy. Okay, so homeopathy, from what I understand, is treating like for like. So they're giving an extremely minute amount of what is potentially causing the disease to the animal, or the condition, not disease, the condition, in saying that the animal will recognize that and hence bring up some form of immunity against it. Okay, so from what I understand, that's homeopathy. Certainly used in complementary medicine. A lot of my customers, they use it, they swear by it. If the animal is fine, personally I don't see the sort of a health being affected. Then I'm like, whatever, make the animal. I'm always treating the animal, not the condition. Yep. T-touch. So T-touch is a special way of manipulating the sort of superficial and slightly deeper skin to muscle level. Okay, and they have a certain way of it's almost like massage, but in a very, very specific manner. And same again, I believe, and that is my personal vet, I do not know anything about this belief, is that I think it probably works in two different ways. One is massage, because and T-touch is a specific way of doing massage. And secondly, the touch itself. I think sometimes we do underestimate the power of touch. We all like being touched. If that touch makes you feel better about yourself and you walk better, amazing. so to speak. So and that is what I sort of perceive T-touch to be. And I personally haven't had too much experience with it. I know a practitioner who does T-touch, and certainly there's a lot of good reviews about it. So good, that's certainly out there as well. It doesn't involve anything else, so that's also fairly benign. Yeah, so that's there really. Bowen technique, same again. From what I understand, it is also a form of manipulation, but in a certain way. So that is known as Bowen technique. So same again, I've got some customers who say that I've sent my dogs for Bowen technique and the dog responds very well to it. I'm not going to say no to that. Good, keep doing whatever you're doing that is responding well to that. So that's out there as well. Herbal medicine. So certainly, giving sort of herbal medicine has been sort of shown to help. And without sounding random, a lot of our early drugs are all plants and herbs of some form. So if they're going down to the root core, giving herbal medicine and it helps, great. I don't think it does too much really. Obviously, unless you use herbs that are not good for the animals. Chiropractic osteopathy. So from what I understand, chiropractic is a manipulation of rather more focus on the spine itself, whereas osteopathy is more focused on the muscles and the joints itself. So same again, there are animals chiropractor out there, animals osteopath out there, and whether it is another form of manipulation or massage, not too, God forbid, and I'll be shot on for saying this, not too dissimilar to Bowen technique and T-touch, but just in a different way, and the animal is sort of getting better with that. It's out there as well, so that's good. Reiki. Okay, this is the one whereby I'm a little bit more skeptical whether it is good or bad, because personally I went to try Reiki and I had Reiki done and I was like, okay, everybody was talking about, let's go and have a session and see what happens. And it is the lightest touch ever, if even, and it's supposed to be transmitting energy to me and helping the joints and all these sort of things. So I'll list the verdict out there to how well Reiki does. I know randomly in Singapore there's a vet that does Reiki. The only thing which I'm even more skeptical about it is because he does it over the phone. I'm like, what? So it's like, how does that work? So, but that's just my limiting belief, and that just shows my ignorance of Reiki. And same again, if it works in some individuals, I'm not going to stop to say that. Please, if it works, please do it. If it doesn't, I'm not too surprised either. But that's just my limiting belief and my ignorance. And the bug flower remedy. So, how many of you guys have heard of bug flower remedy? Good. Yeah, so basically it is talking about using the essence of flower or the power of flower or the medicine of flower, so to speak. And it is prepared and it is given to the animal. So it's all very similar to sort of not herbal medicine, but it's using flowers and things like that. Same again, no drugs. So certainly that has had quite good results in certain hands. And if if the animal responds to that, amazing, because it's not a drug. There's little to no side effects to that, and that is the way to go really. So these are all the other complement treatments that I have sort of researched and come up with, and this is what I've heard of and what people have mentioned to me. And all I can say about this is that I'm not against complementary treatments at all. Okay, and I firmly believe that if it works for the animal, for the individual, please do it. Okay, this is the bit that even the sort of a college of vet surgeons, they're a little bit sort of apprehensive about in endorsing this, is that if we are doing this instead of sort of a treatment that can help the animal and the animal is suffering, then that becomes a problem. If you see what I mean. Okay, so that's why I like to use the word complementary, not alternative. Because alternative gives the indication of I'm using something different. Complementary is I'm using it together. So that's just my personal take on it, but that's what I've sort of come up with really.